For arthritis, for gout, which is sometimes called gouty arthritis, I don't like that term, but it shows up on tests. So for gout, we know that for gout, there's an increase in uric acid production in the blood serum. So the uric acid test would be key to diagnose gout. The particular test that's sometimes used for rheumatoid arthritis and other inflammatory diseases would be the erythrocyte sedimentation rate. For degenerative arthritis, we know that this is called the wear and tear disease. It's localized and it affects the weight-bearing joints, specifically the knees and the hips and the spine. The bony ankylosis that occurs sometimes, and we use the term spondylolithiasis also, when the bone is irritated, it causes the osteoblasts to create new bone cells, osteocytes. But for some reason, the osteoclasts don't come in and smooth it. So you actually have irregular bone growth on a bone that tends to rub onto other bones. And this can either be in a joint, it can be your sacrum, the 5 bones that are fused together that come in contact with the ilium. Sometimes ankylosis occurs there, bony ankylosis. This can restrict joint movement. Bony ankylosis also occurs on the vertebrae of the spine too. For osteoporosis, we've kind of gone over that today. One of the key problems of osteoporosis is pathological fractures. They're very common in osteoporosis. Pathological fractures of the vertebrae, pathological fractures of the neck, of the femur. For osteomyelitis, we've covered that today. Infection of the bone. Again, aseptic or sterile technique should be used in the warm soap, dressing changes, etc. Antibiotics will be the treatment. And this should be looked out for patients who have compound fractures. The different types of bone fractures, I said to be able to describe those. Key ones are probably going to be the closed or the simple fracture. The open or the compound fracture. The comminuted fracture, when the bone is broken into several fragments. Pathological fracture, which would be a result of either a tumor, osteoporosis. And what's special about a green stick fracture?
In kids.
It's common in children.
Okay, very common in children. It's more or less of a splintering without the actual break. I would want to write in here someplace lordosis, scoliosis, and kyphosis. Be able to define what they are and where they occur. The complications of fractures, I've indicated the 3 most common ones: fatty embolism syndrome, The signs and symptoms, classic signs and symptoms would be petechiae on the neck, chest, and axillary region, dyspnea, mental status changes, or fatty embolism syndrome. Compartment syndrome would be paresthesia, numbness, tingling, severe pain, edema that may or may not be visible, decreased or altered pulses, change in capillary refill, differences in color and temperature of the skin, so abnormal neurovascular checks. And thrombosis would be irritation or redness along the course of a vein. For thrombosis, definitely the leg should be elevated. The patient should be on bed rest. The physician may order TED stockings and warm compresses. Anticoagulants may be ordered by the physician. Scratch off the signs and symptoms of hip fracture. For surgeries, the joint replacement and repair, knee, hip. Do we have any questions? We went over this pretty thorough the other day. Do look over your handout on the do's and don'ts after these surgeries. And remember, what position does the hip have to be kept in?
Abducted.
Abduction, away from. And you use, again, the abductor pillow. Just think of a V, okay? Routine pre- and post-op care. Part of the key things routine post-op care that you can use, as I told you, you can use for any surgical patient is make sure that you look under the patient for any bleeding. Thyroidectomy patients tend to bleed under the neck and the head. The blood runs down. Hip tends to go underneath the buttocks. Knee tends to go underneath the popliteal area in the bed. It just follows gravity. So no matter where the dressing is on top of the patient, put a glove on, feel under the patient, turn them, look. Okay? Check the blood pressure, check the pulse. What's key signs and symptoms of shock?
Low, thready pulse,
Okay,
clammy,
weak, rapid, thready pulse, shallow, rapid respirations,
tachycardia.
cool, clammy skin. Hypotension will be the last sign and symptom. Probably the two classic ones are cold, clammy skin and a weak, thready pulse on a post-op patient. You better pick that up right away. Very common, okay? Okay, the cast care, again, I suggested that you look over that block, what was that, 46-2? Okay, cast care, we kind of talked it to death, rolling with the palms of the hands, okay, pedaling, using the moleskin, elevating, usually on no more than 2 pillows. You can apply ice bags as ordered. Read the question to see if it's plaster or fiberglass, because fiberglass dries faster than plaster. Fiberglass dries in about 6 to 8 or 9 hours. Plaster dries any place from 48 to 72, depending on the humidity, I'm told. For cast, things should not be stuck down the cast to scratch, nor should moisture get under the cast. So if the client wants to take a shower or do something, the arm should be securely wrapped and taped in plastic bags. You can, I'm told you can also buy cast
They
protectors.
have cast bags now.
Do they work very well?
I don't know, I couldn't find them, my son
Okay, we usually just used a plastic
Like a
bag
trash
with
bag.
duct tape
Mm-hmm.
around it. You know, it was okay.
It worked.
Yeah, it worked. I mean, it really did. It was okay. A little kind of funny, but. Okay, positioning up, you do not want to keep people in cast, again, since these are extremities, in dependent positions. What's a dependent position?
Position where they can move themselves,
No.
or they need help.
Dependent position.
Or they can be
Hanging down. So when you sit with your arms hanging down, or you sit with your legs hanging down, that's a dependent position. Your use of dependent is correct, but it's another meaning of dependent, okay? Having to depend on somebody. But a dependent means it's hanging down. So a fresh cast on an arm should not be left hanging down. It should be elevated on a pillow higher than the heart,
Mm-hmm.
okay? Same with the leg. It should not be hung over or left hanging down, because what happens?
Swelling.
Edema, swelling and edema, okay? So by elevating it on two pillows, or two pillows which is about equal to or higher than the heart for the most standpoint, then that helps relieve some of the edema, okay? Definitely for the first 24 to 48 hours. And whether it's plaster or fiberglass, you still don't want to get dampness underneath that cast. Okay, traction, I've indicated the types of skin traction. You need to be able to define these. The bucks can be a straight pull or boot traction. The Russell, the sling, or the popliteal hammock. And the Bryant's, it's used for children under the age of 3, butt off the bed. Both legs are elevated. Skeletal, you'll have wires, pins, tongs, halos. How do you clean wires and pins?
Isn't it with cotton,
Like soap and water.
like cotton swabs?
Okay, cotton
Yeah,
swabs,
the
Like
betadine.
around.
using
Yeah.
hydrogen
Hydrogen
peroxide, betadine, or
Yeah.
whatever the facility protocol is. You won't
Yes.
have dressings on those. Okay, they're being exposed to the air. And what are you going to be looking for?
Drainage.
Any drainage, what is that?
Swelling.
Okay, drainage, redness, edema, excessive pain. Okay, for tongs and halo, the tongs again would be the Crutchfield tongs in the head. These are used for cervical injuries, and we'll talk more about these in the neuro. Halo, which actually has the wires come down, remember the bars come down to hold the head. The key thing about the halo is when the person looks, this is how they need to look from side to side. If they can turn their head in there, then there's something wrong with the
They're
setup.
not supposed to be able to, right?
Right.
Something like that.
They have to turn the whole body to
I
look.
have the whole thing to get it.
Okay. Other types of equipment will be the ropes, pulleys, weights. Make sure that the ropes, the knots are tied.
Never move the weights.
Hands off the weights. Okay? Client has to be kept in good body alignment. The higher the patient is in the bed, the more the weights are actually distributed better. So if the patient starts sliding down near the bottom of the bed, the weights are going to be sitting on
So
the
you
floor.
want to bring them back up without touching
The
anything.
weights, right. If anybody misses that question, I will break your little fingers. It's going to weigh on it. Okay, skincare. Again, you can change beds from bottom to top or top to bottom. And skincare is really cool. This is why making sure the draw sheet or the turn sheet is real tight, there's no wrinkles. Having the patient use the trapeze bar and watch your face. For amputations, we talked about the types, AK, BK. The positioning will be prone a couple times a day as ordered by the physician to prevent what?
Hip or
Contraction.
contraction.
Okay. And there'd also be questions on general pain management. With a amputation, we said rehabilitation should ideally begin pre-op, okay? If that isn't possible, then post-op, but ideally we're say before the surgery, because we're going to address this as anticipated or surgical amputation, not so much traumatic. With clients who have arthritis, you want them to do their exercise to the point of pain and then stop and rest the joint. So it's exercise to where they're uncomfortable, stop, rest the joint, exercise, stop, rest the joint. Bless you. Please make sure you look over things that patients are not supposed to do after they've had hip replacement surgery. Okay, when is osteoporosis usually seen?
Middle age.
Older, or elderly?
Usually.
Postmenopausal
Oh, postmenopausal, yeah.
women. Okay. And if a client has gout, what type of diet would you anticipate there
Low
being?
purine.
Low purine.
Low purine, okay. Okay, you'll have a couple questions with multiple answers. 2 or 3 of them. Okay. Sometimes prior to orthopedic surgery or musculoskeletal surgery, TED stockings are ordered for the patient. What's the purpose of TED stockings?
So that promotes circulation.
Okay, to help increase venous circulation, return to the heart, and prevent
Prevent pooling of the blood.
pooling of blood. That's correct. Okay. Okay, my dears. Okay,
Is that it?
that's what we do, yeah. Okay, I